Hey mama, have you ever heard someone ask, why would anyone want a natural birth when you can have an epidural? Maybe you've even wondered that yourself. In this video, I'm sharing 5 reasons why natural births are actually good for you and your baby. I'm Bridget, I'm a childbirth educator, birth doula, and a mama to 3. And if you're new to this channel, make sure you subscribe and hit the bell. It is full of resources that are encouraging, evidence-based, and empowering to you during your pregnancy, birth, and postpartum journey. So the first reason why natural birth is good for you is that labor without an epidural gives you more freedom of movement. An epidural numbs the body from the belly down, which eliminates your ability to get up and move. Movement during labor is so important because it helps baby move from the top of the pelvis to the bottom of the pelvis and then out through the birth canal. Now the pelvis has 3 levels, and depending on the movements mama makes with her body, the various levels of the pelvis will open accordingly. Being upright and using gravity also enables an easier descent for baby through the pelvis and the birth canal. In the Built to Birth course, I teach you movements and positions that you can use all throughout labor that actually open up various levels of the pelvis. The Built to Birth course is linked down below for you to check out. Now with an epidural, there are still so many positions that you can do to support an open pelvis, and I also teach you those in the Built to Birth course. But with an epidural, movements can be a little bit more difficult to get into, and they are less intuitive and instinctual because you have a lack of sensation. When your sensations are present in labor, movements are more instinctual and without an epidural, easier to get into and change. The second reason why natural birth is good for you is that it gives your hormones the ability to work without interference. Your labor and birth are fine-tuned to your hormones, and interruption and interference in this cocktail of hormones that drive labor does not come without downfalls. In one study, the amount of oxytocin was lower in women who had epidurals during labor. Oxytocin is what drives labor, which means epidurals have the risk of slowing labor down. Oxytocin also builds throughout labor, with its biggest surge at the end of labor, which contributes to something called the fetal ejection reflex, which is when mama's body naturally pushes baby out involuntarily, making the actual part of birthing easier and shorter than with an epidural. At the end of labor, because of the increase of other hormones, adrenaline is also released, and when this happens right before birth, it gives mama energy to push and baby the energy to take their first big breath and support respiration in the first few moments. Epidurals are correlated to increased risk of respiratory distress and lower APGAR scores in newborn babies. Allowing labor to unfold using its natural hormones aids in mama's ability to cope with her intensifying sensations because as oxytocin increases, so does her other hormones that alleviate pain, distort time, and lower stress. Pitocin is another interference in the body's natural cocktail of labor hormones. Pitocin is synthetic oxytocin, and research supports that use of synthetic oxytocin in labor is associated with uterine atony, which is basically the uterus too weak to contract, and an increased risk of postpartum hemorrhage. It also increases the risk of postpartum depression and the risk of breastfeeding issues after birth. When we allow the hormones to do their job in a natural labor, birth and breastfeeding are usually healthier. If you want to learn how to support your body's natural flow of labor hormones, you can take my free mini birth class linked in the description below. The third reason is that epidurals contain fentanyl that cross into the placenta. Epidurals contain a concoction of drugs that create their numbing effect in mama's body. Fentanyl is one of those drugs. Research supports, and you can check out those resources down below, that fentanyl is found in the umbilical cord, baby's bloodstream, and even mama's breast milk after the use of epidural analgesia. Fentanyl can cause initial breastfeeding challenges and is a strong toxin that ideally most would want to avoid in any human's body, but especially a brand new tiny human. Number 4, a natural birth has less chances of falling into the cascade of interventions. When we intervene in labor one way, there is a ripple effect that often creates a need for another intervention down the road. And this is called the cascade of interventions. For example, an induction can cause surges that are too strong for mama to handle, so she opts in for an epidural. This epidural impacts the body's natural release of oxytocin, so her labor slows down and labor augmentation medications need to be used. While mama is pushing, she can't feel her pelvic floor or her body's natural urges, so pushing can be prolonged. Baby might get distressed, and forceps or a vacuum might be used to bring baby through the birth canal. When labor begins spontaneously, a woman is less likely to get an epidural. If she doesn't get an epidural, her labor is often faster and usually won't require an assisted delivery using vacuum or forceps, which can cause physical trauma for both mama and baby. Now, I know as a birth worker that sometimes interventions become necessary, whether that's a medical necessity or a personal necessity. And if you want to learn how to keep labor moving along as naturally and normal as possible, even with the use of interventions, you can learn all about that in the Built to Birth course, which is linked down below. Now, the fifth thing, natural birth promotes breastfeeding. The hormone oxytocin increases within the body as labor progresses. The body's natural oxytocin helps your milk let down, which is when the breasts release the milk to come through the ducts towards the nipple after birth. When baby is skin to skin with mama, oxytocin continues to rise and aid in breastfeeding. Some interventions that impact breastfeeding are intravenous fluids that can contribute to excess newborn weight loss that a pediatrician might see and then recommend unnecessary supplementation of formula or cause painful swelling of the breast that makes it difficult to breastfeed. Epidurals can make babies more sleepy and less alert to latch on right after birth. They can also interfere with the release of oxytocin, which can impact how mama's milk comes in. C-sections often delay a mama's mature milk from coming in for days or even weeks, and forceps or vacuum deliveries can create challenges in a baby's suck, swallow, and breathing coordination. So those are some reasons why natural physiologic birth isn't an empty goal. There are so many benefits, and it's actually good for you and your baby. Laboring without interventions or interference allows you to move more freely, which protects your baby from getting stuck in the pelvis. It allows your hormones to work exactly as they should to assist in the birth of your baby and reduce mama's pain. Natural labors don't involve toxic substances that cross from mama to the placenta and to the baby. Avoiding one intervention helps avoid many others that might become necessary because of that first intervention, and natural birth paves the way for a more natural inlet to breastfeeding. Now, if you are planning for a natural birth, tell me in the comments down below what are some reasons that you are planning a natural birth for. And if you're ready to learn how to support the natural and normal unfolding of labor, make sure you click the square on the screen right here to take you to the Built to Birth course. Bye, mamas.